keynote speaker, Dr. Sara Al Dalal from United Arab Emirates, and she's going to speak about value-based healthcare. You can remember yesterday we were talking about the value of medicine and how it impacts on people, how we look into effectiveness and value as well. So today we are having a general outlook and talk from Dr. Sara on value-based healthcare. Meanwhile, before she starts, I'll just quickly make a brief introduction of Dr. Sara Al Dalal from United Arab Emirates. Dr. Sara, okay, she's the president of the Emirates Medical Associations. Emirates Health Economics Society is a medical doctor, and she graduated from United Arab Emirates University College of Medicine and Health Sciences. She's completed her internal medicine residency in Dubai Health Authority, and she holds a master in healthcare management from Royal Colleges of Surgery in Ireland. That's great. She's currently holding the position of Senior Health Services Specialist in the Insurance Policy Development Section in Dubai Health Insurance Corporation. On behalf of the UCG Conference 2021, I welcome Dr. Sara Al Dalal to this conference this morning. Welcome.
Good morning, everyone. Good morning, or good afternoon, or good day, wherever you are. Dr. Sharifat, thank you for the kind introduction. Just please tell me that my slides are up and running, isn't it?
Yes, they are.
Thank you so much, Dr. Sharifat, and thank you everyone who is tuning in from wherever you are at any place in the world. So as Dr. Sharifat has introduced myself, I am a doctor by practice, and I have completed my medical degrees, and then I moved forward and I did a couple of degrees, master's degrees, one in healthcare management, and the other ones are in health policy and health economics from the London School of Economics. So as Dr. Sharifa said, in day one of the conference, and which is a very great conference that you have here, you have discussed about value and value of medicine and things, and this will get more of a topic as we move on forward. Probably it could be a discussion that we will have with the pandemic coming through or not. But everyone has their own perception of what could be a value of something. The patients want something, a Dr. X wants something, Dr. Y wants something, and the administrators would want something. So let's explore this idea. What is value-based healthcare? I just want to tell you that this is just a basics, and I most probably will ask you some prompting questions, and please feel free to put anything you like in the chat box, because I would be asking certain things as I move along. Now, I want somebody to say, since we are here today, I want somebody to help me out with this. I want you to tell me, what do you think quality of care is? How can I quantify quality of care? Good afternoon, Dr. Amal. I'm seeing your messages. Can somebody tell me, what do you think is quality of care? Is quality bringing the best equipments and assuring that these best equipments are used on the patients correctly? What do you think quality is? If somebody can just mention anything in the chat box, I would be really glad to hear your concepts and how quality may tie with value. Patient-centered care. Thank you, Carl. So if I am talking about patient-centered care, so patient comes first, but how do you know that patient comes? What does the patient want, and what is the quality that the patient is asking for? So let's explore that. Let's say that these are the two definitions from the biggest organizations around the world, talking about quality of care. And how do we define quality of care? is on the basis of several definitions. Now, it's a debatable topic so far because everyone would like to talk about quality of care from their own perspectives, and there is not a set definition. But at the end of the day, what quality of care is the extent to which any healthcare service that you're providing to the patients or the individuals, or maybe healthy individuals, is leading to a certain health outcome. So in order to do that, it's correct what Carl said, it should be people-centered, and this is according to the WHO. Now let's look at the Institute for Healthcare Improvement, which is an institute based in the United States of America, and they have pretty much said the same thing. But what they have added in another component is that you should have a consistency with the current professional knowledge. So you don't want to base the quality of care or patient-centered care, or even the premise of being safe, effective, efficient, equitable, to something that is of past professional knowledge. You wanted something to be current professional knowledge and current and achievable. Now, there are two things that I want you to think about, and probably with the value-based healthcare and how it ties with quality of care, is efficiency and equity. Now, efficiency is just you have certain resources and you want everyone to get these certain resources to the best maximal use. You have certain number of beds, you want the most number of patients to take the most efficient use without having or avoiding the most possible waste that could be done. And equitable, which is something that we are talking about more and more nowadays, and probably in the last decade or so, is that you have to customize that care for that patient. So the quality of care is not about one kind of patient population, is that every patient population and every patient needs a certain unique needs, and we have to think the quality of care should revolve around that. Going to the second slide, I'm not sure if you're, okay, there we go. So we're talking about health outcomes, but how do we reach those health outcomes? But what is the definition of a health outcome? A definition of a health outcome is a change in a health individuals. Don't tell me a health outcome is something that is static. No, we should think about something that has happened to a patient or a group of patients, and it is related, this change, it's not done by random. It should be a series of interventions that were imposed to a certain individuals, and it caused that change. So there is where we quantify it, and there where we need to know that that care that was given led to a probable health outcome. Now, the definition when it comes to the United States of America, they would like to see that this health outcome is what the patient cares about most. All of us were definitely different here. And every patient, every walk of life, every experience, patient experience, the health outcomes that they are looking or desiring for is different. So we need to think about that and account that if you're looking at achieving the best, most optimal health outcome, and also of thinking at the background, having patient-centered care and having the equity or equitable care in the equation. Now, why am I talking about all of this? Now, health outcome measurement is not something simple. It came from the 1950s and moved till 2014 as it was an established measure. But if you can see there are lots of things that went over the last 60 or 70 years. And in the beginning, talking about looking at the processes and slowly getting the patient to have their voice in determining the patient care and the quality of care, and having the family perception. Like, for example, the elderly or the younger population or the caregivers have a say when it comes to patient care, because they are basically taking care of these patients, not only the healthcare professionals or the providers. there's something that we need to think about when it comes to health outcomes, and why, again, I will come to that at some point, how this will tie up to value-based healthcare, because this is a very important concept, which is called patient-reported outcome measures. This is where the outcome measures are directly reported by the patient. It's not the doctor who's ticking a box. It's not. It's something that is coming from the patient's mouths, from the patient's hands, from the patient's perspective on what do they think of a health outcome. Now, they are usually done in a tool format, and I would love to see, while we're talking, if any of the esteemed audience today have worked with patient-reported outcome measurements, and do they know about it? Did they implement it in their facilities? Did they see any change looking before and after a service is added? I would love to hear from you. I would love to see that interaction. In real life, I like to interact, but now with Zoom and with all these online platforms, it can be a little bit tricky to have this. But I would love to hear if really you captured certain measures, and how does the patient think about it being valued and looked at them from a different angle. Now, when we're talking about patient-reported outcome measurements, it's not only to have it done as to look at the performance of a certain measure, or if this clinical introduction of a certain procedure or an intervention went out well, but also it gives us a very important idea. It is the value for money. Does this device or this product or this medication or this surgery is worth the money of the payer? Sometimes the payer is the government, sometimes the payer is the patient. And when somebody is taking money out of their pockets to make a change in a patient's life, then we need to know, was that worth it or not? We all purchase our basic needs, but it's sometimes very difficult to know if a certain intervention or drug or whatever it may be have led to a very important, or led to a very progressive quality of care in certain individuals. Now, I'm still waiting for your contributions in the chat box if you have done anything to do with patient-reported outcomes. Well, let me softly introduce you to the value-based healthcare. We just talked about why is outcome measurements important, but here we will talk about the value of having what health outcome measures that we talk to these patients are most valuable on the cost. Most of the people think value equals money, but it's not the case when it comes to value-based healthcare. It is this equation that you can think of. It is not primarily the value of X equals Y. The value of drug Y is $100. No, it is what this value, what this medication or this intervention have brought up when it comes to cost and led to a probable health outcome. And this is the definition of success. If you reach to a high value, then you are reaching to a definite success. And in this whole equation, usually whatever is defining a value is probably the people who worked on a certain intervention, or probably pharmaceutical companies or medical products, medical device products, drugs, or maybe administrators or payers or whomever it be. But when it comes to value-based healthcare, we are taking the patient's perspective into it. So there, the decision will be shared with the patient on how important the value is. Now, it is not as simple. It could be as simple or as difficult as you may make it sound, but there are 6 core principles that when we're talking about value-based healthcare, Again, I would like to encourage the audience, if they have heard of this concept, or if they have worked with it, or what are their challenges, or what are the advantages of this system, is that just they have to share it in the chat box. And I'm keeping an eye on the chat box. So let's talk about how we can place this value-based healthcare concept and getting your organizations to the best successful outcomes. And I'm sure everyone on this platform today wants the best outcome of care. I've never heard of any doctor, healthcare professional, nurse saying, Adwin, that they don't want the most optimal care out there. So the value-based healthcare is one of the key tools that can make you go through that. But for that, you need six factors to put you on the map. Now, I need to have a disclaimer. This model that I'm discussing today is the model that was proposed by the Harvard School and by Professor Michael Porter. And I would be very glad to share with the audience where does these come from as in references. And if you'd like to practice it in your organization, you're more than free to do so. So first, you have to think about your patients. Who are your patients that will really benefit of having a value-based healthcare model for? We need to start at a certain level. We need to think about these patients. You cannot start flat out and say, I will do it across. No, you can do it across, but you have to categorize these patients, and you have to categorize these patients in patient conditions. And I will give you examples in a short while. And then when you categorize these patients and put them in a basket, let's say, you have to think about the outcomes of these patients and what are the costs attached to that. So now we're talking about the cost of care for these patients and the outcomes that you are most probably looking after. Now, number 3 and number 5 are looking at things more in deep down, as in how we can put the cost in a simplified manner to make things easier, to make it as one bundle payment, rather than me paying for every visit or for not. Then I give you a bundle. I give you a package where I'll pay for once, and then I'll look at the outcomes that is attached to that. And to be very comprehensive, you have to think about the patient full entirety of care. Sometimes you deliver care in one clinic, but the patient, for example, in diabetes or in other clinics, he has to go to multiple specialties, and you have to coordinate with every specialty to make sure that the patient journey is captured all throughout. Or else, how would you know that you are getting to that patient outcome measures that you are more likely to achieve? Carl, I have seen your comment, and it is quite right. So, but to have that, let me go to the second slide. You need a robust, as you can see, the basis, you need an IT system. Nowadays, we are talking in IT systems and how IT systems are very much so required to put everyone on the same map. And nowadays, having an electronic health record, having people communicating together, it is much more easier to have all this interaction. And by the way, everything should be going in round and circles. There should be a good communication. There should be good leadership, good communication in between all of these 6 factors. And let me be honest, feedback should be in every step. If there is something that is not working out, it should be feedback and looped, and changes should be done as we go on and move forward. So it's an ongoing process with everything in healthcare, but it's ongoing, on-spot kind of a process. Now I will go one by one and discuss things. And Dr. Sharifat, just tell me if I'm surpassing my time. but I will not take time. I'm putting my timer right beside me. So let me think, because I'm too passionate about value-based healthcare. I don't want to go on and on and on talk about it. But let me think about this. Again, I want you to tell me and to tell me your difficulties about communicating across your own organization, communicating across two different doctors who are actually in the same department, who are not even talking to each other. Have you faced that? Or maybe they have certain differences in care patterns, or they like to do certain things in a different way. I mean, come on, everybody we have met a certain form of that. So if you have met such doctors, please your hand, or just send me a chat box that's, yeah, I've faced it, and this will, but value-based healthcare will put everyone under that mat. And it will make life easier for everyone across the board. So, but we have to start with the medical condition. Let's say diabetes, because everybody is well aware of diabetes and it's a common disease. So we have to target diabetics. But let me make it much more difficult. There are many examples of having gestational diabetes, which are diabetes that happens particularly in pregnant women. So when we're talking about diabetes, just for the sake of the example that we have now, I'm just talking about diabetes in general, but value-based healthcare goes a bit more deeper into that to have the best outcome for that. Now, when we're talking about diabetes, we have to think, we have to put the patient's hat on, and we have to define it from the patient's perspective. And then we have to map out the journey and look at your clinical guidelines that you follow, and look at the clinical pathways that you have. If you don't have, create one, and think about the multiple specialties that are used to be looked into for that. And then think about diabetes. Well, diabetes doesn't come along. It comes with infections. It comes with dental issues. It comes with heart issues. It comes with whatnot. So we have to bring all of this together, and we have to put it in some kind of form and call it there we go, an integrated practice unit. Now, because diabetes is quite complex, I used an example, which is called acute hip and knee osteoarthritis, which is basically as we grow older, your joints start to wear and tear, and you start to have these joint aches or joint pains, which are called acute hip and knee osteoarthritis. For the most part, many of the patients will go and have a knee replacement. But here, we are trying to, I'm giving you a real life example of a value of an integrated practice unit. You can see it starts from the monitoring and preventing. So if you go to your general practitioner or your family medicine, wherever you're practicing around the world, then you start at an earlier stage with monitoring and preventing the complications. And then as you come across, as you can see, the downstream and the upstream, as you come across, then you have to look at the diagnosis, at the preparing, and then the intervention. Sometimes the intervention will be in the form of a cast, in a surgical manner, and then rehabilitation. And after the rehabilitation is a monitoring. So here, as you can see, value-based healthcare model is not a one-stop shop kind of a patient. You will see the patient for years, from starting monitoring and preventing till having the monitoring and preventing at the end stage, by going through the whole spectrum. And as you can see on your left-hand side, that there are certain levels that you can think of. And I want you to go back and please, if somebody saw something like this, Carl or Dr. Emel, if you have seen something like this practice before, just drop me something in the chat box, and everybody is welcome. So if you can take that, it may be a daunting practice, but believe me, it's not really difficult. If you can think about having measurement, accessing care delivery, you are doing all of these things, but most of the people have now put it in a chart all across the patient journey. Now, this I will keep you to look at, and it's something that I want everybody to explore. I'm still awaiting for your questions in the chat box, but while I'm taking it through, we need a good leadership for this. We need a good vision. We need everyone to be on board. We need everyone, and that's not on the from the clinical side, also from the financial side and the administrative side. We need to get everyone on board to tell them, listen, this is what is happening. These are my patients. I will select these patients. I will put this through. I will discuss with other specialties. I will see whatever they are thinking is correct or no. And then I'll feed that to the financial structure where they will say, now I can know where I can put the outcome measurements and gather it from who and when, and what costs should be attached to that. So basically, that is what I'm trying to get to. Now here it comes at the outcome measurement. The outcome measurement simply is, once I know that there is a diabetic patient, I want to know if their blood sugar control is under checks, right? I want to know that they are not getting into the hospital more often. I want to know that they're not getting into the ICU. I want to know that they're not dying earlier than they're supposed to. Now, Carl has mentioned something that we follow KPIs when measuring outcomes in practice. That is true. But now, when we're talking at the whole spectrum, then your KPIs will be focused to that patient rather than saying in general. But when we're talking about, for example, difficult diabetic patients or patients with diabetes in pregnancy, then it will be a focused KPI all throughout the journey. And I'm sure that all healthcare organizations around the world, they are calculating and collecting KPIs. Well, let me ask you, Carl, and everyone who's in this webinar today, when you are calculating this KPI, do you think there are major drastic changes that are happening? Is it useful to capture all of these KPIs that you're capturing? Because this is a discussion that I would love to hear, because most of the time you hear people were capturing it because it's required. But when it comes to value-based healthcare, when there's money attached to it, then there should be some kind of changes. And that's where I'm going towards. So it's not only I want to know how many people developed bed sores, or how many people got admitted, or how many people got this or that. But when it comes to, or infections, hospital-acquired infections, but when you attach a cost to that, people are well aware that you need to do some kind of change. Going to the second slide, this is how outcome measurements can be either complicated or much more simplistic. There are three tiers when we're talking about outcome measurements. The simple first tier is if the patient dies or lives. And then as you go down and down, you will look at complications. And then the third tier, which is the most important tier, in my opinion, is to look at the long term rather than the short term outcomes. We want the patients to be back and healthy and have a longer term improved healthcare outcomes. I'll give an example. This is for breast cancer. And as you can see, this is the integrated practice unit. Now, breast cancer is not as grim as it used to be. Nowadays, people patients are getting more and more into remission, are getting more and more into, well, we're getting, thank you, Evdokia, are getting more into remission. So for me, it's very important to have the whole spectrum. I just don't want to stop at, well, the cancer is gone. No, I want to know in 3 years' time, 4 years' time, after the cancer is gone and the patient is on the road of recovery, that they are doing well. So there is the basic principle of value-based healthcare. And as you can see, the monitoring part, which is on the right-hand side, after the patient went through all of that, starting from having a screening mammogram to getting depicted, and then to having office visits probably once a year after the remission comes, then we need to know about the long-term consequences. And I'll keep you to think about this, that recovery and rehabilitating is not the end. We need to think about the other step. Unfortunately, nowadays we have a very short, narrow focus that we need to only think about getting the patient recovered. No, we need to think about the longer term of consequences, because the patients are not just having that type of a care, because they will go back to their normal activities, and we need to keep an eye to come and have that together. Now, Carl has mentioned something which KPIs are assisting the practice where they can help assist improving patient care. I am totally in agreeing with you, and I'm very sorry I'm using your first names, but if you're a doctor, it's Dr. Carl, thank you so much. They are helping us in utilizing, but to reach our highest performance as clinician. Dr. Carl, thank you so much. But do you agree with me? Sometimes there are certain KPIs that you would think of are not that particularly necessary, and they are just gathered for the sake of gathering, or just for the sake of putting it on some kind of platform. If I ask many people, they usually come back to me and tell me, yeah, there are certain KPIs that I gather is just an extra time that I'm doing, but I don't know where am I reaching to. From the list of 100 or 200 KPIs that you're capturing, maybe 10 or 15 maybe of real value. But when we are talking about this integrated practice unit that you're thinking in front, that you are seeing in front of you, will just capture what is required as a KPI. Now, I do have 10 more minutes, so let me hurry up because I do have a lot of slides. This is again the KPIs that we're talking about and the long-term consequences. And for breast cancer patients, for example, as we see that younger and younger patients are having breast cancer, but we need to know in the future, are they able to be pregnant or not? Do we ever think of this as a KPI? I don't think so. I don't assume so. Not many people do think about it, but to the patient, it's quite important. To a female patient who went through breast cancer, it is quite important on the longer term. Now, cost measurements. I know that many healthcare professionals don't like to talk about cost, but I will make it much more easier for people to grasp that idea. Now, if I attach the KPIs and the health outcome to a cost measurement, then it will make my life much more easier. Then I would say, yeah, I did this, then I'll get rewarded for that. I did this, then I'll value you for that. And this will give an incentive for doctors to do better, even for patients to do that better. Because if they are paying out of their pockets, and they know that their doctors and their healthcare administrators are talking about, you get better, you will be paid that amount, then this will help you make things better, rather than stopping a fee that all, for example, consultation fees are a fixed amount, let's say a $50 per hour. No, but when I am seeing that, no, there is a value, a cost attached to that as a value. If you did a great job, I'll give you a $50, but next time I'll give you a $20 for a follow-up. Then there's certain things will take into value. And that's why value-based healthcare looks into that. Now, let's talk about bundle payments. This makes it easier for doctors, for administrators, for even patients. As you can see, I have shown you earlier the integrated practice unit. And if I bundle, if I put groupings for every stage, it will make it easier for everyone. So let's say, rather than me putting a bundle and attaching that bundle payment to an outcome measure, then it will make it easier. If you're not doing well, you're being paid basically on what you have provided me. If not, then you will be paid more as you have done better. And I came to that outcome measures, and you will be paid less, for example, if you didn't reach to that outcome measure. And this is in many countries are called pay for performance in healthcare, by even rewarding or penalizing, it depends. And if somebody heard about this concept or even practicing this concept, please drop it in the chat box. I'll be more than happy to take your questions and answers at the question and A's, and tell you more about what could be done in an effective manner when it comes to pay for performance. There are many examples. The WHO has a manual where they are looking at what could be done as in pay for performance. And there are many examples around the world. It could be as an outpatient, it could be as an inpatient, it could be as both a hybrid of an inpatient and an outpatient. Some people will look at it from different measures. Now, the US and many countries look at unplanned readmissions within a certain time. So if a patient was admitted, for example, with a pneumonia as a chest infection, and got readmitted and was discharged safely, and got readmitted, for example, within the next 30 days with the complications, or even that the patient was not improving, then in these circumstances, the hospital will not be paid the full amount of the service, because they do believe that the patient didn't receive the optimal care. Now, we can discuss more further what could happen when the patient gets discharged, but there should be some accountability to the hospitals to provide the most optimal type of care, so the health outcomes that comes with that is being paid for it fairly. Now, there are many things that we will talk about, but here where I am talking about is that pay for performance should not be generalized. Let's say the patient was receiving the most optimal care in the hospital, but at home he doesn't have a caregiver to take care of him. He has a high risk of aspiration because he doesn't have somebody who to assist him at home, or he will go back to smoking, or he will do something that may not be quite conduct. Maybe he doesn't have enough amount of money or something to buy, for example, the medication. So we have to think about it when we're talking about value-based payments or value-based healthcare or pay for performance, that it should be on the continuum, even when it comes to the social care. And that's why what I'm trying to talk about, it's a continuum. And it should be a change in the behavior and the financial incentives. And we need to get data out of that. Data is very important in value-based healthcare. And that's why we need system integration. We need IT to be foremost and to be there with us from the beginning. Now, as I just mentioned earlier, we need to have that integration laid out and put into every component. And it's not only the geography of care and value that we have to think about. We need to also have that kind of system that we need to talk with our colleagues from different specialties to be on board with us. We need to allocate services to make life easier for patients. How many times do you send the patients down the road and they say, oh, where is it? How, the GP will have certain services, but will not have the whole spectrum of services, which is normal. And this is what is happening. So you'll tell them, listen, you have to go and do an X-ray. It will be in the building X and building Y and building C. And the patient usually tend to get lost in all of this and comes back to you unless they are well aware of the system. So we need to have that communication quite well laid out for the patient too, and have care coordinators in every facility. And this is quite important. IT is IT. We need a unified IT system, or if not a unified IT system, we need an IT system that picks the most important parts from the different IT systems and make life easier on the doctors, on the nurses, on the patients, on the administrators, on everyone out there. So it's quite important to have that. Now, this is basically in a nutshell about what is value-based healthcare. And I would love to hear and start this conversation with what could be the your concepts. And I would love to hear from Carl and Dr. Emel, Dr. Carl, Dr. Emel, and whoever was mentioning. Did you ever practice value-based healthcare? And what have you heard from the presentation today that you would like to take it forward and have it practiced at your side? If you can open your mics, if that is something that is possible and feasible, I would love to hear that from you.
Hi, Dr. Sarah.
Hello. Oh, hi, Carl. How are you doing?
Hiya. Yeah, I thought it was a really good presentation, and it really highlighted a lot of important things in healthcare, especially when looking at the person as a whole and including them in the decision-making process, and taking on it's also going to be cost effective. It's difficult sometimes because sometimes people, when they need to get an X-ray or a scan, sometimes it might be costly and it might not need to get that, or there might be a reason they might not indicate that, so they follow certain guidelines to get that. But I think it's important that it's finding that balance, isn't it, where it's improving patient care and quality of care, and that way then you're also saving money in the long run if you do it the best way.
Yes, Carl, yes. The thing is with value-based healthcare, and I didn't mention that because I don't want to give the administrators a bit of a panic here. There should be some investment beforehand. All of this, the IT system, getting care coordinators, getting people, getting the communication there, whether it was a capital investment or even time, as in investing your time in building the system. And going through that myself in a smaller level, at a smaller level, I knew the challenges. You need good leadership. And you need everyone to be on board. You need the patient to buy in into all of that. So having that platform would require investment prior hand. And then you will see on the long term, there will be some cost savings. So usually this concept is been bought into right now. And thank you, Carl, for telling me that. Actually, I don't know if you can follow me on LinkedIn. I will put in the chat box my personal email. And please feel free, anyone who would like to bounce off ideas, talk to me more. I can share my experiences, and I can tell you how you can move forward with your endeavors in practicing value-based healthcare. You shouldn't be doing the whole thing from the get-go. Start at smaller level, like bits and pieces, and see how it will move.
Thank you very much.
Thank you very much. That was a good offer. Is there anybody that has any other contribution or any other questions or you want just to go directly through LinkedIn?
I didn't put my LinkedIn, but I put
to be honest, when you say you're looking for answers, all your slides, the talk is my answers.
Really? Thank you.
Questions, and the answers are just coming through. You know, when you're in the health system and you're looking at, okay, why is this, and why do you have to do this, and why is this happening this way, and you're just pushing it out. And for everybody that has been involved in healthcare for over a couple of years, you know what we're talking about, our value of healthcare. We're looking at maximizing leadership. We're looking at maximizing workforce. We're maximizing the equipment. We're maximizing everything. Now we're looking at the value to the healthcare, so without compromising patient care.
Exactly.
So this is very interesting, educative, and informative talk. And I think I would advise people to go back and watch it on YouTube. And at the same time, if you have any questions or any any issues, or you want to develop more, please contact Dr. Sarah on our LinkedIn profile. I am going to contact you because I'm doing a lot of work around that area. It's my passion, and I really love it so much.
My pleasure. My pleasure.
And thank you very much. I'm still waiting. If there's any other person that needs to make a speech or questions or support or any other questions. Maria said, thank you, Dr. Sarah, great talk. No, that's a very beautiful
you
word.
so much.
Yes, yes, yeah, thank you so much. And it was so concise and straight to the point. I mean, we have lovely speakers today. It's so amazing. Thank you so much for joining us.
Thank you so much.
Still waiting. If there's anybody that still have any contribution, any questions, and we can go ahead with this second, fourth speakers.